This final lecture of our three-part series on a practical guide to the DM Casebook will focus on the discussion, conclusion, and references. So this is the final session, and the objectives we're going to focus on are how to construct and write your discussion, your conclusion, and references while adhering to the DM Casebook regulations. We are going to talk a little bit about appropriate citation format and the choice and use of relevant references. So as we discussed in the previous lecture, there are three types of discussion. The topical discussion, which consists of an initial outline of your case, introducing the topic of focus, a detailed discussion of the topic of focus, and then a discussion on the application and applicability to the local setting. The controversial discussion, which would start again with an initial outline of the case, a clarification of what the controversy is, and a justification for choosing this controversy to discuss. Then a more detailed discussion about the controversy itself, bearing in mind that you need to present all different points of view because you're discussing a controversy. And then finally, sort of, coming down on one or other side of the argument, your personal view of what is the most appropriate approach, argument, or position, again, given our local context. And finally, we have the rare or unusual case, which would start with a general outline about the case, talking a little bit about its importance and relevance. And then a more traditional discussion, talking about things like epidemiology, pathophysiology, clinical presentation, investigation, treatment, and prognosis. Let's go into each of these in a bit more detail. So the topical case. So we're going to start with an outline of the case, whether it's, pulmonary embolism, ischemic heart disease, talk a little bit about how common it is, why it might be important to the emergency physician, what the traditional approach might be to this case, just a broad outline of the case itself, no more than 1 or 2 paragraphs. This is not your focus of discussion. Then we're going to introduce the topic that is the focus of discussion. So you say, this is what I'm going to talk about. I'm going to talk about advances in the management of acute coronary syndrome. I'm going to talk about new ideas in the approach to the septic patient or something like that. And give a little detail. Talk a little bit about why this particular topic of focus is relevant, why it might be particularly important to the local setting. You are introducing the stage for your focus of discussion. The next bit is going to be a detailed discussion of the topic of focus with an in-depth analysis and exploration of the topic. Remember, throughout this discussion, you're going to refer back to your case. This is what literature says. This is what we did. This is why we did it. This is how this researcher advises us to approach this particular topic. However, we did something slightly different because this wasn't available to us, or because this is particularly more relevant in our setting where, we see more obesity, or our hypertensive don't respond to drugs as we like them, as other people might, or something like that. Again, this may include figures and tables where appropriate, but if you're going to, in your discussion, use clinical pictures, they really should come from your patient again. If you start using things from other patients and try to pass them off as your patient, that will run you into trouble. And then finally, in the last maybe 1 to 3 paragraphs, we're going to put the discussion in a local context. So we talked about the world literature, we talked about the research out there. Now we're going to say, but this is how we do it in Trinidad, or This is how I suggest we do it in Trinidad. For many of these topical discussions, this part may include your recommendation for some kind of guideline, protocol, flow diagram, which can be included in your discussion to say, I think that this is how we should approach elderly patients with thromboembolism, and figure X shows a suggested flow diagram for the management of these patients. That always looks good at the end of your discussion. It puts you in the context of being an expert on this topic in the local setting. Right, let's talk about the controversial discussion. Again, 1 or 2 paragraphs just outlining the case, why this particular pathology might be important, or this particular presentation is relevant to the emergency doctor, and why it might be controversial. Just an initial introduction, not too detailed. We just said, here's the case. It was, this case highlighted the dilemmas of managing pulmonary embolism in older people, and demonstrates the difficulty in our patient. This happened. This didn't happen. We will now discuss why these choices may have been made and what is in the literature to support or refute the approach taken. Then we're going to talk about the controversy. You introduce the idea, you say why it's controversial, why that controversy is particularly important to the emergency physician. You outline why this particular case and controversy may be relevant locally, and refer back to your case, why this controversy may have caused the people dealing with our case to make the decisions they made. Then, again, a detailed discussion of the controversy. Remember, don't be biased at this stage. Present all sides of the argument. You might have a clear idea what you think should be done, but still present all sides objectively, analyzing pros and cons, strengths and weaknesses of each approach, and referencing it back to your case and whether these arguments would have applied to your case or maybe would not have applied to your case. Again, you may include figures and tables where appropriate, but if you're talking about clinical pictures, they should, x-rays, ECGs, scans, they should really come from your patient, unless you're saying, this is what my patient's ECG looks like. However, it seems as though in the literature, a more common ECG would be this, and I'm just showing you this other ECG to compare with what our patient presented with, or something like that. And then finally, you really need to give your own point of view. It's no point talking about a controversy, but not making up your own mind about what should be done. Your point of view needs to be in the context of the Caribbean, Trinidad and Tobago, where you work, and you need to talk about which aspects of this controversy may apply locally and which may not, and why. Finally, we're going to talk about the rare or unusual case. So again, you need to give an outline of the case, and you kind of have to sell yourself here. You're going to talk about something that is not common. So you have to say, it's not common, but it is relevant and important despite its rarity because of X, Y, or Z. And also why this rare case might be of interest to the local fraternity in emergency medicine. We're going to then move on to our detailed discussion. This is 6 to 8 paragraphs, and for most rare or unusual cases, we take on more of the role of the teacher. So you're going to talk about your index case, and you're going to talk about, the definition of this condition, its epidemiology, pathophysiology, its presentation, investigation, treatment, prognosis. You might use all these elements, but you're kind of doing a more traditional case discussion because it's a rare case and you're trying to teach somebody about something they may not have seen, but they need to know about. Again, you might include figures and tables, If you're going to use clinical pictures as before, they should come from your patient. And then finally, you need to bring this back home. Why is this case particularly relevant locally? And what aspects of the topic may not apply locally because of resource limitations, because of differences in presentation or pathology in the West Indies. The conclusion is just a brief summary and recap of your case and discussion. And the main purpose is to leave the reader with one key learning point. Only about 100 to 200 words, which is one short paragraph, really. Sometimes you might have to use two, but really one short paragraph. Do not introduce any new material at this stage. And one paragraph is about recapping the main points of your discussion, reiterating the relevance of the case to the emergency medicine and locally, and leaving the reader with one key learning point. You'll find a lot of this in your casebook manual. You need to have between 20 and 25 references per case. We use the Vancouver style of references. Don't try to do this manually. Learn how to use a reference manager. There are many reference managers that can be incorporated into your word processor program. Most of us use Word. Try to make sure that your references are by and large not more than 5 years old, and definitely not more than 10 years old. However, bear in mind that there are some older papers you just have to quote. If you're going to talk about definitive management of coronary artery disease, at some point you're going to have to go back to the ISIS trials and just mention them. This is where all this started. And they are, I think, more than 20 years old. They're actually a lot more than 20 years old now. But those are seminal papers that need to be referenced. So it's not a hard and fast rule that all your references must be 5 years old. But the majority of your references discussing your case would be 5 years old, no more than 10 years old. You're up to 5 years old, try not to be more than 10 years old. If you're really going to talk about specific research that is key to your discussion, then you need to be able to critically appraise that research and make a judgment about its importance and relevance to the paper, to your discussion. Do not plagiarize. I will say no more about this. You need to know what plagiarism is and avoid it. That's a discussion for a different time. So, if you have any questions or comments, you can post it on the WhatsApp group, you can email me, or you can bring it up in class on a Wednesday. In summary, this lecture talked about producing an appropriate and acceptable discussion, conclusion, and references, which adhere to the DM Casebook regulations. It also talked a little bit about utilizing appropriate citation format and using relevant references. I hope that this three-part series was useful in giving you a practical guide to writing your casebooks. I would strongly suggest that you bookmark these lectures and refer back to them as you write your cases. Remember, the first case is always the most difficult, but using the structure, I hope it will be a little bit easier to tackle. Thank you very much.